The haggle over compensation for senior house officers and medical interns in public health facilities has hit a stalemate following a letter from the Ministry of Health instructing public hospital directors and private not-for-profit heads to discontinue paying allowances for medical interns and senior house officers receiving salary on the government payroll as verified by the Ministry of Public Service, refugee medical interns and all senior house officers on government scholarships. The Uganda Medical Association has termed this development as illegal.
Any civil servant, if you're going to affect their emoluments, you must first of all consult them and tell them that did not happen. If you finally consult them and maybe convince them, you must give them ample warning. 3 months notice. That did not happen.
According to the association, the Ministry of Health further quotes the public service standing orders, albeit falsely, to deny the health workers their entitlement.
We went and visited the Ministry of Health, which denied having authored that kind of document, but they said they are going to come back to us. We were shocked about 2 days ago to receive the message from the Ministry of Health confirming this message, but actually dated October 1st, which means they have been sitting on this information.
In a rather bizarre moment, the address to the press was made outside the offices of the Uganda Medical Association Secretariat after an unknown person locked the doors with chains. The association says they are taking legal action.
Dr. Olaro, you are the one who signed that notification. We are suing you personally. The Ministry of Health, PS and Minister, we are suing you personally for disenfranchising the weakest of our fraternity.
Up to 300 interns and senior health officers have gone 3 months with unpaid allowances amounting to 900 million shillings.
As defaults, the doctors will reduce the working hours and go and look for money to make sure their families survive.
A 2021 presidential directive mandated that medical interns be paid 2.7 million shillings, intern pharmacists 2.7 million, intern midwives and nurses 2.2 million, and intern dental surgeon doctors 2.7 million. Until last year, deployed medical interns, including doctors, pharmacists and nurses, were earning a net monthly allowance of 2.5 million shillings to facilitate their feeding and accommodation. However, the government reduced this amount to 1 million shillings per month. Ministry of Health requires more than 35 billion shillings annually to cater for the allowances, but they claim government is failing to meet its end of the pledge. Walter Mwesije, NTV.